We often hear that accommodations are unfair. So the question for you is, do accommodations pose an unfair advantage? Think about it before you respond. Researchers have compared the performance of dyslexic and typical reading college students on timed and untimed tests. The results were consistent. Only students diagnosed as dyslexic actually showed a significant improvement in test scores with additional time. Those who worry about the advantage of extra time for a person who is dyslexic fail to appreciate that even with additional time, this individual will continue to feel rushed. Extra time is not an advantage. It is an attempt to level the playing field. Even with the additional time, a slow reader will continue to feel at least the same or more time pressure compared to the ordinary reader. No one wants to feel different, including dyslexic boys and girls. And if not absolutely necessary, they would much rather not require accommodations. For the most part, being treated differently brings about embarrassment and shame. Students request and accept accommodations because they have no choice if the exam is to be a measure of their ability rather than their slow reading. How does the need for accommodations on exams influence the kinds of work the dyslexic person will be able to do once he is out of school? Will he be able to do the job? What do you think? Most dyslexics can and do succeed in the job. A dyslexic generally does not have a problem practicing medicine or law or engineering or writing novels or plays if he can survive the hurdle of timed multiple choice tests. These tests tap a dyslexic's weakness. In law, the ability to read quickly or to carry out rote mechanical skills is often confused with the ability to think and reason. Early on, few would have predicted that David Boies, who did not learn to read until 3rd grade, would become the leader in a field that seemed so dependent on reading. Yet Boies' life experience reinforces the dictum that it is not how fast you read, but how well you think that counts. Boies' approach is to skim through the text until he recognizes what is important. Then he slows down, hones in on his material, and carefully reads the critical facts. He has an uncanny ability to grasp exactly what is important. Once he has set his sights on the most meaningful target for further analysis, he can concentrate on this much reduced volume of material and carefully analyze it. Earlier, I mentioned dyslexic physicians, including surgeons, who have thrived. What flies in the face of so much that we assume to be related to surgical expertise is that some of the most renowned surgeons failed anatomy. That's right, failed anatomy in medical school. One of those surgeons told me that anatomy, as usually taught in the first year of medical school, is not related to surgical skills. Quote, "It actually has little to do with the practice of surgery," he told me. Performance in a first-year anatomy course has more to do with the ability to memorize the names of assorted body parts by rote. Most surgeons are in agreement that, quote, "surgery has to do with thinking, with judgment, with knowing what to do, and not with knowing the names of particular structures. Hopefully, this information will caution educators to be more thoughtful in their career counseling. They should not assume that dyslexic medical students who have trouble memorizing anatomic labels cannot become outstanding surgeons. Slow-reading lawyers, poor-spelling writers, and surgeons who struggled with anatomy in medical school, they all flout conventional wisdom. From these individuals, we learn that reading slowly tells nothing about the ability to comprehend, that poor spelling has little to do with one's ability to write creatively, and that an inability to memorize or rapidly retrieve the names of anatomical structures does not portend one's skills in operating on these same body parts. Many school advisors would have counseled each one of these individuals against pursuing their chosen career, in which they have found such fulfillment while also contributing to society. I hope that educators and parents alike will encourage children who are dyslexic to pursue their dreams. I'd heard you say, as many dyslexic physicians have, the hard part with dyslexia is getting it through the academics. It's not about practicing medicine.
No. I was CEO of the Cleveland Clinic for 13 years, and that's what I retired from.
And you created a lot of firsts at the Cleveland Clinic. For example, your motto, patients first. Tell me about that.
Well, when I found out that I was going to be the CEO about 6 months before I actually took the job, and I would think about what I needed to do, and I was trying to figure out why, what was the unifying factor around the Cleveland Clinic, because we did research, we did education, we did clinical care. And I realized that there was only one reason that we got paid, or we had a job, or we had the buildings, clinic, hospital, et cetera, and that was for patients. So I decided that since that was the main reason we were here, that would be our mantra going forward. It would be patients first. And it turns out that that became our North Star. And really, when you come to a fork in the road, you always decided, oh, what's the right thing to do for the patients? And it led a lot of the things that we did over the next several years. I think that at the end of the day, dyslexia is a gift. And if you can get through the academics and you learn the persistence of getting through, it will serve you well through the rest of your life. And the fact that you think differently about things is a huge advantage. That has probably been the biggest professional advantage for me, is the fact that I don't look at things the same way that most other people do.